Hi everyone, welcome to PharmaExplora. In our previous discussions, we discussed what is pharmacology and its two main categories, and the definition of pharmacokinetics and the definition of pharmacodynamics. So to recap, we can say we define pharmacokinetics as what our body does to the drug, and we define pharmacodynamics as what the drug does to our body. So, if you like to know more about these concepts, you can watch our previous videos. I have put the link below, so you can go through it. Now, as you can see, before a drug molecule reaches to its receptor and do its job, first of all, it has to enter our body. So, how do we choose whether a patient should swallow a pill or receive an injection or put a patch on the skin? So, today we are opening a highly practical concept or practical chapter in pharmacology. This is about the routes of drug administration. So today we will be discussing an overview of routes of drug administration. So let's get started. Okay, now as you can see, the routes of drug administration can be divided into three main categories: the enteral route, parenteral route, and the other specialized drug administration pathways. So, other category includes oral inhalation, nasal inhalation, intrathecal or intraventricular administration, the topical administration, transdermal administration, as well as the rectal administration. Now let's discuss each of these route of administration briefly. Okay, first let's discuss about the most common route of drug administration. So that is the enteral route. So first we are going to discuss the most common the drug administration route, that is enteral route. So this term enteral means involving the gastrointestinal tract. Involving the gastrointestinal tract. So this enteral route primary have three methods of uh, administration. Those are oral administration, the sublingual administration, and the buccal administration. So the oral administration is you swallow the tablet or the pill and it travels down to your stomach and intestine to get absorbed. So the oral administration is you take the pill by mouth and it travels down to your stomach and intestine to get absorbed. And the sublingual administration is you don't swallow the pill, you keep the pill under your tongue. So you keep the pill under your tongue until it dissolves and absorbs completely. So that is the sublingual administration. So sublingual administration, you don't swallow the pill, you keep it under the tongue. And then comes the buccal administration. The buccal administration is that you keep the medicine between your cheek and the gum. So you keep the medicine between your cheek and the gum, and there also you don't swallow the pill. So the enteral route means primarily involving the gastrointestinal tract. So taking the medicine by mouth, primary we divided into three main methods: the oral administration, sublingual administration, and the buccal administration. In oral administration, you swallow the pill, it travels down to your stomach and the intestine to get absorbed. In sublingual, you keep the pill under your tongue until it dissolves and get absorbed. You don't swallow the pill. In the buccal administration, you keep the drug between your cheek and gum. You don't swallow the pill there as well. So this enteral route is the most common. most convenient and the most safest route of administration available today. So, we can say we define the enteral route is involving gastrointestinal tract, gastrointestinal tract. Then we divided the taking the pill by mouth into three methods: oral, sublingual, and buccal administration. And this enteral route is the most safest, most economical, as well as most convenient method route of drug administration available today. So this is an overview about the enteral route. Okay, now we are coming to discuss the second major category, parenteral route. So we are going to discuss the parenteral route. So in parenteral route, we directly introduce drug into the systemic circulation. We directly introduce drug into the systemic circulation. In simple words, we can say we directly introduces drug into the bloodstream. So here we directly introduce drug into the systemic circulation. Systemic circulation or to the bloodstream. So why we using parenteral route? So parenteral route we are using for the drug molecules that are poorly absorbed or unstable in the gastrointestinal tract. For the drugs that are poorly absorbed or unstable in the gastrointestinal tract, we can use this parenteral route of administration. And also, when we at emergencies, when we use the rapid onset of action, we directly apply the drug into the systemic circulation, or we use this parenteral route. So in instances where emergencies where we need the rapid onset of action. So in our previous videos, we discussed what is this rapid onset of action. That means how quickly drug will start to work. So in emergencies where we need the rapid onset of action, we use the parenteral route. And also the unconscious patients who cannot the swallow pill or use the enteral route, we use the parenteral route for unconscious patients. So these are the instances where we mainly use parenteral route. The drugs which are poorly absorbed or unstable, and also in the emergencies where we need the rapid onset of action, and also the unconscious patients. The advantage of this parenteral route is the clinicians have the ultimate control of the exact dose delivered to the bloodstream. So here you can see why, because we are introducing drug directly into the bloodstream. So the clinicians have the ultimate control of the drugs that or the exact dose delivered into the systemic circulation, unlike in the enteral route. So that is the advantage of the parenteral route. And As same as the enteral route, here also we have primarily three methods: the intravascular, intramuscular, and the subcutaneous. So the intravascular means we are introducing drug either into the vein or either into the artery. So we call intravenous where we apply drug into the vein, and we introduce drug into the artery, we call it intra-arterial method. So that is the intravascular. Then comes the intramuscular method of administration. The intramuscular method is we introduce the drug into the large muscle mass of our body. So we introduce drug into the large muscle mass of our body. That is intramuscular. Then the subcutaneous. The subcutaneous is we introduce the drug or we inject the drug into the fatty layer of the tissues just beneath the epidermis and the dermis of the skin. There is a fatty layer of tissue where we introduce drug into that layer, that is called the subcutaneous. So those are the three methods of the parenteral route. And also, I want to discuss a special concern of this parenteral route as well. So, in our previous part, we discussed the oral administration or the enteral route is kind of safest route. And when it comes to the parenteral route, there we have to pay special attention. Why? When it comes to the enteral route or the oral administration, we taking the medicine through mouth. So the overdoses, toxicities, those can be overcome by using the antidotes like activated charcoal. When we use the enteral route, we taking the drugs by mouth. So when the overdoses or the toxicities happen, we can correct or we can overcome that situation using the antidotes like activated charcoal. But the concern here is we introduce the parenteral route drug directly into the systemic circulation. So we introduce drug directly into the bloodstream. So this method is irreversible. This method is irreversible. So that is why this parenteral route we have to pay special care about when we be using the systemic circulation. We introducing the drug into this systemic circulation, or in other words, we have to pay special attention when we use this parenteral route. So, and also this might cause the pain, fear, and the local tissue damage, and also sometimes the risk of infection as well. So this is the overview of the parenteral route. Okay, now we are coming to the third part of our discussion, that is the other route of drug administration. The other category includes all other specialized pathways of routes of drug administration. So those are oral inhalation, nasal inhalation, intrathecal or intraventricular administration, then the topical administration, transdermal administration, as well as the rectal administration. Now let's discuss one by one briefly. So oral inhalation is we inhale the drug orally. We inhale the drug orally. So this oral inhalation allows drug molecule to absorb rapidly through the mucous membrane of the respiratory tract and the pulmonary epithelium. So, because of this large absorption area available for the drug molecules, this oral inhalation is very fast and very effective for the respiratory tract disorders. So, we use oral inhalation to treat fast and effectively for this respiratory tract disorders. Now the second one, nasal inhalation. nasal inhalation is we apply the drug through our nasal passages. So we administering or applying the drug through nasal passages is the nasal inhalation. So the very common example is applying the oxymetazoline nasal decongestant through this nasal inhalation. And also we use the desmopressin nasal spray to treat diabetes insipidus using this nasal inhalation route of administration. So the diabetes insipidus is the rare disorder which can cause unusual large amount of dilute urine, and also it might cause the unquenchable thirst for the patient. So that is about the nasal inhalation. And the intrathecal or intraventricular administration. This is the route of administration. We bypass the most difficult and most important blood-brain barrier of our body to treat the diseases can cause in the brain and the spine. So here we apply the drug directly into the cerebrospinal fluid, bypassing the blood-brain barrier. So this method usually used in life-saving situations. So one example is administering intrathecal amphotericin B for cryptococcal meningitis. So this cryptococcal meningitis is the life-threatening fungal disease occur in the meninges or the tissues covering the brain and the spine. So this is the intrathecal amphotericin B for cryptococcal meningitis is one good example for applying drugs directly into the cerebrospinal fluid, bypassing the blood-brain barrier. Then the topical. Topical is we applying externally. So we use this topical administration when we require strictly the local effect. When we require strictly the local effect, we use this topical administration. So the clotrimazole cream, it is antifungal. So to treat the skin fungal infection, applying the clotrimazole cream on the affected area is good example for this topical route of administration. And then comes the transdermal drug administration. The transdermal administration is we place a patch on our skin. We place a patch on our skin. So this will deliver medications systemically and slowly. Sometimes it allows for a few hours and even for days. So this transdermal route of administration deliver medication systemically and also slowly. And final one, the rectal administration. So the rectal administration is we apply or we introduce drugs through rectum. We use this method of administration for localized treatments as well as systemic circulation. So this method can be used for patients who are unconscious or who can't take the medicines, like the vomiting patients. We can use this route of administration. So here in our third part we discuss the routes of administration: the oral inhalation, nasal inhalation, intrathecal or intraventricular route of administration, topical route of administration, transdermal, and the rectal administration. And this is the overview of other routes of drug administration. Okay, to wrap up, today we discussed another interesting topic in pharmacology: the routes of drug administration. So we discussed that before a drug molecule reaches to its target and perform therapeutic effect, first of all, it has to enter our body. So there are several methods using to administer particular drug molecule into our body. So those are discussed under the routes of administration. So we divided the routes of administration mainly into three categories: enteral route, parenteral route, and other. So the category contains all the other specialized pathways that we use to administer medicines into our body. So the enteral route we define as the taking the medicine orally, or the methods involved with the gastrointestinal tract. And the parenteral route is the route where we administer drug into the systemic circulation directly. And under other methods, we discussed briefly about this oral inhalation, nasal inhalation, intrathecal and intraventricular administration, the topical, transdermal, as well as the rectal administration. So in future, we are expecting to discuss these each route in detail separately. So, and also to conclude, now you can see selecting or choosing a particular route of administration for a particular medicine, it isn't just random decision. It's a decision based on the properties of the drug as well as the therapeutic outcome we want. Now let me repeat it again. Now the selecting the route of administration for a particular drug isn't the random decision. It determined by two main aspects. The first one, the properties of the particular drug molecule, whether that particular drug molecule is water soluble, or whether it's lipid soluble, or whether it's unstable in the stomach, the gastrointestinal tract, or whether it's poorly absorbed. Likewise, those parameters determine the route of administration. And also, the most importantly, the therapeutic outcome we want, also a critical factor determines this route of administration. Like whether we want the rapid onset of action at emergency, or whether we want treatment for a long-term chronic disease, or sometimes whether we want to the particular treatment to a local area to avoid exposing that our whole body for that particular medicine to minimize the side effects. Likewise, the therapeutic outcome also determine the decision of routes of administration. So, the route of administration determined by the properties of the drug as well as the therapeutic outcome. So I hope you have learned something from this video. If you found this video helpful, just hit the subscribe button and stay tuned for our next session. Thank you very much for joining with PharmaExplora. See you soon.